Imagine this. You're 6 months pregnant and you're preparing for your baby like most expectant parents do. You're trying to figure out what color to paint the nursery, what's the best pediatrician for you and your family, what's the perfect car seat to use. You haven't even picked out a name yet. You're doing all of these things to plan for the arrival of your bundle of joy. No rush. You still have 3 months to go. No big deal. When suddenly you start to feel like something's not right, so you go to the hospital. 12 hours later, you have a baby. 3 months early, but she was ready to come into this world right now. You just gave premature birth. Premature birth is when a woman delivers a baby prior to 37 weeks gestation. 40 weeks is the average term for a normal full-term delivery. I'm very familiar with premature birth because my niece was born at 6 months gestation. She was 3 months early, and she spent 6 months in the neonatal intensive care unit in the hospital, which is a specialized unit for babies. She has a tube under her brain, under her skull, that keeps fluid off of her brain and it drains into her stomach, and she's 5 years old now. So I am very well versed in the complications of a preterm birth. Today I will inform you all of how premature labor is defined. I will inform you of the complications and risks that go along with premature birth, as well as some of the statistics of premature birth. All right, some of the statistics. According to a recent article from the marchofdimes.org, 1 out of 10 babies will be born prematurely. About 450,000 babies a year in the United States will be born prematurely, so it is way more common than people think. Also, according to a recent article from the CDC.gov, premature births are increasing. This is a study from 1967 until 2001, and every year it's just steadily increased. Mississippi, Alabama, and Louisiana, according to the marchofdimes.org, is some of the worst states to have a premature baby. They all have failed in care for preterm deliveries. Right, now that we've talked about some of the statistics, we'll talk about some of the risk factors that can contribute to a woman giving birth to a premature baby. Some of the risk factors that a woman can control: smoking cigarettes, doing illegal drugs, drinking alcohol can cause preterm labors. Unnecessary stress to the mother can cause a preterm delivery. Now there are some risk factors that the woman cannot control. High blood pressure sometimes can't be controlled. A woman who is having multiple babies, a multiple birth, a lot of times those are delivered early. Age is also, the increase in age for the mother increases the risk of having a preterm delivery. Now that we've talked about some of the risks, let's talk about some of the complications for the baby if they're born early. According to an article from babies.org, the earlier the baby is born, of course, the complication chances are increased. Once they get over about 23, 24 weeks, they have a greater chance of survival, but they still have a higher risk of complications. Some of the complications that a preterm baby can face: a brain bleed, swelling of the brain. They can have a heart defect called a PDA, which is very common. It's a hole in the heart. A lot of times it will close up on its own, but sometimes it has to have surgery. The lungs are not fully developed. The earlier, the less developed they are. This image right here is the lungs of a preterm baby. On this side, you can see are fully developed lungs. So definitely a big difference. A lot of babies have to be put on a breathing machine. A lot of them cannot feed on their own, so they have to have a feeding tube. They cannot control their temperature, so they have to stay in an incubator. They're smaller in size. A lot of times they're behind in development also. So now that we have learned some about preterm births, One thing we can take from this is we usually all know someone who has either given preterm birth or who is a premature baby themselves. The more, of course, that you know, the greater chances you are to deal with it better if this happens to you. I know my family wishes that we would have learned more prior, so we would have known what to expect when my niece was born. One thing that I have learned from this, and I can tell you, just because a baby is born premature does not mean that they will not grow up to be a happy, healthy child. And my niece is definitely an example of that.